I now have the honor of introducing our keynote speaker. Dr. Cameron Matthews serves as the VA's Assistant Undersecretary for Health for Clinical Services and is the Chief Medical Officer for the Veterans Health Administration. Formerly, Dr. Matthews served as the Assistant Undersecretary for Health for Community Care, where she was responsible for the community-based provider network that expanded veteran access to care. Dr. Matthews is a board-certified family physician, advocate, and policymaker with a career focused on underserved patient populations. She joined the VA in 2016 after multiple leadership roles in Chicago in correctional medicine, federally qualified health centers, and managed care. Welcome, Dr. Matthews.
Thank you so much, Dr. Greenberg. Can you hear me well? Just a quick mic check.
Yes, ma'am.
Good. And Secretary McDonough, I cannot believe I'm following you. I absolutely feel ashamed to even follow that. But I hope to give the audience an additional set of information. I defer everything to Secretary McDonough in every way and truly appreciate your leadership, sir. Thank you for really taking us in a new direction with VA. I am excited to join this conversation just because this is in every respect, not only in VA, but just in my larger career and interests within healthcare, a priority for me. And again, as the Secretary just said, a priority for the agency. But I think I'd love to bring you some perspective from the Veterans Health Administration, from where we are as a workforce, from really where we've come through throughout the pandemic, and where I think we can go. I want to infuse into my background that Dr. Greenberg just shared some of the work that I do in this space. I'm very proud to have visited some of, hopefully, the campuses that are represented on the call today, in the summit today, through my nonprofit organization that I've been running now since about 2012, called the Tour for Diversity in Medicine. We take a group of physicians, podiatrists, pharmacists, dentists to HBCU campuses, HSI campuses around the country, and lead really professional development courses to really try to motivate students into medicine, dentistry, pharmacy. Our goal is to really approach diversification by thinking outside of the box. And part of that is recognizing that so many of our students coming through your institutions, coming through many institutions, even PWIs around the country, really need that additional push, that additional source of mentoring, that additional motivation in order to even think of healthcare. And it's a sad state of affairs that we even have to do that there is an equity in really even exposing young students to this opportunity. And so I approach my work in equity and diversity with that in mind, that I see it as my personal charge to connect with students around the country. So I am eager to even promote the same within VHA, VA, as we talk about partnerships with all of you as affiliates. But let me focus on VA and just bring you a little bit of kind of grounding information, something really I think that's helpful for you to understand where you might sit in your collaboration with us. Let's jump to the next slide. We are in Veterans Health Administration, obviously maybe not obviously, but maybe worth promoting, the largest integrated health system in the nation. And what that means, I'll share some statistics, but integrated in the sense that we look at our patient population as more than patients, that we are taking care of them as veterans first and foremost, not just patients, that we, of course, are connected with the Veterans Benefits Administration and making sure that they are receiving the benefits that they so justly earned, and that we are addressing their healthcare needs in as integrated of a fashion as opposed to what I would argue in most of the commercial healthcare sector is extremely siloed and segmented. Primary care over here, behavioral health over here, specialty care over here. We are really seeking to make sure that we are providing care in as veteran-centric of a format as possible, and that could vary based on their needs, right? If we could jump to the next slide, or am I controlling that? There we go. So really, I think it's worth acknowledging that that level of integration actually does reside in more than just the care delivery that we provide, and that our mission statements, our focus, our missions themselves actually go beyond just care delivery, but that we have a strong commitment, and as the largest integrated healthcare system in the country, have a strong history in working in academia and training the future healthcare professional of the country. I myself rotated through the Jesse Brown VA Medical Center during my residency for a couple of rotations. And in that, it is truly our commitment and our need to partner, obviously, in order to do so, but recognizing that the benefit from that training goes to more than just veterans, that we are training really the nation's healthcare professional. The same is with regard to our research mission. And you'll have conversations about this today as well, too, but that clearly there's a broader impact that research focused on veterans, taking veteran data into account, has broader spanning implications and impact. And then I'll speak a little bit more as we move forward, but one that is not as, I think, commonplace of an awareness of VHA's commitment to emergency response. We call it our fourth mission, but it's become ever more, I think, important over the last year in the pandemic, in that we do provide support in larger times of war or national emergency, particularly from a public health standpoint. Our ability to help other healthcare systems has become quite tantamount to our COVID response, to vaccine administration. And this in and of itself clearly shows the alignment of VHA to the entire U.S. healthcare system. And our ability to do so is hinging on the strength of our workforce, on the strength of those we train. And again, that all relates back to needing to assure your collaboration and making sure that that workforce reflects the populations that we serve. First, of course, veterans, but then the others as well, too. Let's jump to the next slide. So more than 1,200 facilities. That's our inpatient, larger medical centers, but then also what we call our CBOCs, our community-based outpatient centers. We treat more than 9 million veterans. Sorry, we have more than 9 million veterans enrolled. We treat just over 6 million veterans. So when we're thinking about just the span there, we're thinking about the geography of where they even sit, with larger proportions of them than the U.S. population being rurally focused. You can really start to think about the social determinants that are involved there, the need for expanded workforce, and really thinking outside of the box to be able to provide care delivery in so many different respects to so many different, even subpopulations of veterans. We employ more than 370,000 healthcare professionals. This clearly, again, touches on our ability to train. We have a workforce that is ready and willing, and honestly committed to training. It's part of our really blood of the institution, as it is in a lot of academic medical centers, I would say, that training becomes part of our care delivery, and we are very committed to that. And we do so with the understanding that quality and veteran-centric care and experience are at the utmost priority. And so with that, we are often able to outperform a lot of our partners. They are our partners. We're not trying to call them out in any sort of way, but we do outperform on many different quality metrics that have definitely been documented throughout the literature. With that, there's always room for improvement, and we have a couple of priorities set by our acting undersecretary, Dr. Richard Stone, where we are hoping to focus on gathering more trust, restoring more trust in our healthcare system by veterans of every breed and kind, so that more than just the 6 million who are currently using our system do continue to reach out to us and perhaps use our system more. That we become a high reliability organization. And I know many of you are familiar with that concept, but that we learn and we continue to improve. And that has been evident, as I'll go into, during the pandemic. And then we continue to modernize. We have a EHR that is world-renowned, but is quite outdated. And we're in the midst of a quite massive deployment to modernize that, as well as other systems. And I'm quite involved with a lot of those efforts. But this just describes VHA, and as do these numbers. Thanks for jumping ahead. We are a large organization. We provide a great amount of care, almost 60 million appointments. portions of that being telehealth that increased over the past year, parallel, I would say, to other health systems as they were needed to during the pandemic. But the fact that we do not have license restrictions with regard to our ability to have federal supremacy with regard to our different licenses for our different healthcare professionals actually allows us to have a much broader scope for telehealth than I think other healthcare systems were able to implement. And of course, the number of providers and particularly nurses that we have in our facilities, again, really speaking to our ability to provide a strong training environment for all of our partners, our academic partners, as they come into our facilities. Next slide. So where are we headed? I spoke a little bit about modernization. We are deploying Cerner, and I'm actually out here in Spokane as we speak, focusing on our Go Live site and the success of that. But there's also other direction that we're going as far as the transparency of our system, providing veterans with a level of transparency about services, access, availability that's really not as equally available in the private sector. Typically in the private sector, you can maybe see a few minutes of wait time for an emergency room on a billboard, maybe you drive by or something, but we really have published information about all of our services, how long it's going to take to get an appointment, available on the website, as you see here. And that is really our commitment to veterans to understand, again, really the capacity of the system and how they can make choices between either coming to the VA or being served in the community. But we recognize that there are specific communities within VA that also need additional support and focus, and those underserved communities have special designation per the Mission Act of 2018. We do focus particularly more on rural healthcare and expanding our telehealth component. And even this Atlas project, as outlined here, is focused on not just are we connecting a veteran at home to the VA, but do we perhaps in some areas where there's not as available broadband or even customer service support in the area, are there pods that we can set up in either VFWs, Walgreens, or the like, where veterans can go in and connect to their provider through a local area station? So we have a lot of really, I think, innovations that we are looking to deploy that are really focused on reaching those veterans who perhaps can't come to our facilities, improving the transparency and access around how to receive our broad services. Next slide. So how did this all really end up being rolled out during the pandemic? I just continue to applaud just the thousands of staff and leaders around the country for how we truly acted as a single health system over the last year. You can jump to the next slide. There was obviously a need for us to act as a single system, but I would argue that prior to the pandemic, it wasn't as infused. There wasn't as strong of a need to truly make sure that we were looking at hiring and expanding of beds and sharing and cross-leveling of supply chain in the real integrated manner that we did during the pandemic. We truly started executing from the very top level here in DC and then spread out across all of our 18 regions or VISNs. We really did start operating in a single health system manner. And this really was founded on basics of high reliability, that we refused to simplify. We refused to really make decisions from DC, but instead manage the decisions with field input because of their expertise and best practices that were being developed in the field. And then we just assisted with diffusing. It was all based on a single data sort of expectations. We needed to create single data definitions and bring it together through our healthcare operations center so that we were reporting out on a 7-day basis and leadership could understand and really interact across our 170 medical centers. I mean, that's a pretty massive feat to think of that as a single enterprise, but yet we did it with, I think, such success that it really speaks to our ability to respond not only in an emergency, but to do so prioritizing veteran experience across the board and maintaining access, more importantly. Next slide. So as I spoke about, we did increase telehealth by a significant proportion, either to home or to any of our, again, CBOCs, community-based outpatient clinics. We actually even expanded different apps that were available to veterans so that they could be monitoring their own symptoms. I mean, there was a lot of this going on in the commercial sector, but being able to do so focused on the veteran population and making sure it was connected back to their primary care teams was the critical piece here, truly integrating all of this information. And our partners, even outside of the healthcare system with VA, the OINT Office of Information and Technology, even stepped up to the plate. We distributed more equipment, and in order to shift our entire workforce at more than 370,000 to telework capacity. And by doing so with laptops and iPhones and the like, I mean, again, not anything that the private sector didn't do, but to do so in such a massive effort in an integrated way where we were assuring quality, we were assuring staff safety, we were assuring veteran access and experience. I think this really, again, spoke to the strength of our health system and our ability to move forward in such a quick time frame, because, of course, all of this happened really last March, April, that it all turned on, and you all went through that as well, too. Next slide. And we learned as we went through it. I mean, part of high reliability, again, is to make sure that there's deference really to the front lines, deference to expertise, and spreading those as best practices. So we even started our own version of a grand rounds that's continuing on even to this day, where we were sharing information, operational information, so that the whole country could hear and take part in conversation. Again, our data surveillance tools were standardized in the quickest fashion possible in order to respond, again, to this public health emergency that just required us to act as one unit. And we did so with a level of expertise where we brought together cells, groups, working groups, making decisions, because of course there's still even unknowns about COVID, right? And how we were actually going to make those decisions, promoting of different treatments, how we're going to make decisions now about vaccines and distribution and the like, really convening both a mix of national and local experts in order to make those decisions, and then again, diffuse those practices throughout the health system. It's really just been a significant success. And I think, again, the leadership of Dr. Stone, the leadership of our VISN directors, our regional directors, truly speaks to just the dropping of all different silos and concerns and our ability to work as a single system in order to assure safety and assure life, given that, unfortunately, COVID in the private sector, unfortunately, might not have had the same outcomes. Next slide. So our fourth mission, again, to highlight that not only were we able to be successful within our facilities and our own response, but then we were able to turn attention to the communities that needed help, needed assistance, particularly around nursing home staffing, nursing home support and training. We did a great deal of work in the First Nations with the Navajo Nation, Cherokee Nation, and even accepting non-veterans into our facilities in a lot of our geographies. We are a part of a health system. We are part of a public health infrastructure, and we've been able to provide that support even to this day. Even this week alone, we had a new mission go out. There's a need for us to obviously recognize that we're part of a larger community, and that's part of our commitment. And so our best practices, our capabilities are shared more broadly than just within our walls, and we're proud to do so. It's our mission, and I think we implement it with great success over the past year. Next slide. Okay, so what does all that mean, right? Some great background. I wanted to brag, if you guys don't mind, I wanted to brag about the success of what VHA has been able to achieve. And with that, with this administration under Secretary McDonough's leadership, of course, we clearly need to look internally to see where we can continue to improve. And I think through our commitment to diversity, equity, and inclusion, not just as a byline, but truly looking operationally of where we need to go as a health system, where we fit within the larger discourse of DEI within healthcare, because of course this is bigger than VA. How can we truly make an impact for our veterans, for our workforce, for workforce morale, in order to address this concern that we know we are battling with as a nation. And I think VHA, we are ready and willing and seeking collaborators such as all of you on the line today in order to truly define actions and take action, more importantly. So next slide, I just want to share some data. This is a little bit older, admittedly, from fiscal year 2018, and we have improving numbers and everything, but sometimes it's a bit hard to track workforce a little bit. But I wanted to share at least a breakdown of what we've been looking at. I've been serving on some of our DEI task force over the past couple of years actually. And really we were looking at our hiring trends. This is again within VHA, so the health administration alone. And this is across all employees on the left. And then SES, our senior executive service, that's a federal designation. So really kind of the upper level executive. And you can see the differentiation there. That is unacceptable. That is something that we are striving to really address. How are we assuring that there's promotions before that? How are we assuring that there's inclusivity? How are we making sure that our staff, again, is reflecting our population that we serve across all levels of the organization? So this in and of itself is something that we recognize we need to address. And by, again, partnering to expand our workforce at every level, we can really seek to take action here. Next slide. This is the breakdown, not just at SES at that executive level, but then you can see the grades, GS 14 through 15 down through 1 through 5 there of the breakdown. And it fits obviously the trends, I would say, in other healthcare sectors and in other industries even, but this is something that is not acceptable. What exactly are the issues that our employees are facing that they are not able to, or we are not that they aren't able, that we are not assuring their promotion to the higher level grades. This crosses all professions, but in and of itself, this data is concerning for us and is unacceptable. Next slide. Then just sharing, if you want a question, of course, when you're starting any equity conversation, it really must be based in the data, right? And so you want to look at indeed, are we getting interested workforce coming to the table? Is this really instead maybe a factor of who's applying, who's joining our actual, or who's applying through USA Jobs or any other means? And there's equity there, except when you get to the selection piece, right? We have application, or at least reflective of higher proportions than our national demographics of African Americans in particular applying for positions and the like. They're qualified, they're referred, but then lower numbers selected, down to 20%, particularly for African Americans. So this in and of itself, again, is a level of data that we need to look at, and then we need to look at it more and more locally. We can't really manage from this high level data. This is national across VHA. But this is the expectation, the type of dashboard that we expect our middle managers, our executives at the facilities to be looking at and to be addressing. Next slide. So then let's break it down even further. Again, I don't necessarily consider myself the best scientist, but the data is so critical here. And so, how do we flesh this out by different professions? And I think this clearly speaks a great amount to where we need to provide some emphasis. Secretary McDonough, of course, spoke about even just the health benefits behind diversifying the physician workforce, but it's also in the literature clearly evident that every profession does actually have a need for diversity, and that there is actual patient outcome improvement when you diversify across all health professions. That's been shown in the literature time and time again. And so when we're looking at these specific fields, I mean, we obviously need to compare them to the breakdown. For instance, optometry, podiatry, what is their national workforce breakdown, and is VA equivalent to that, or do we have some work to do? Same across the nursing fields and others. It's of course, particularly as a physician myself, I'm extremely interested in reasons why any of these professions, but physicians in general, are making decisions about where they work. And that's where really the conversations of inclusivity and how we're actually retaining them, how we're actually allowing for opportunity for growth and promotion within our service. And the same goes across every field. And this is something, again, that we need to assure as a healthcare system that we're providing. Next slide. So where does this audience, where do our minority serving partners come into play? You are critical to how we are going to address health equity as a whole. And by health equity, I mean, of course, our veteran health outcomes, but larger community outcomes as well, particularly because of our larger focus beyond just our walls. We can achieve truly, if we were to diversify our workforce even more, we can achieve the humility really that is necessary in order to meet the needs of our multiple patient populations of different creeds and genders and race and ethnicity. We need that level of competence. We need your workforce in it in order to do so. I understand the rest of the sector, private sector needs it as well too, but I have plenty of reason to promote VA just because of our larger mission of our ability to serve those who have served, and our commitment to training, where I think really your partnership and allowing us to work with your learners really will help us bidirectionally achieving larger goals as well as your own from a training standpoint. Clearly, when we diversify the workforce, we are increasing trust in the health system particularly. And remember, that's one of our goals, restoring trust in VHA, but by having a workforce that looks like the veterans we serve, there's more opportunity for them to trust our healthcare system, to trust our providers, to then really take part in their own care. And again, we see that throughout healthcare. But one we are most committed to, just again, because of our veteran-centric approach to healthcare delivery. We need a diversified workforce to help us modernize as well too. We need broader perspectives so that we can develop different solutions, not just at the operational level, but through the executive level, through central office, so that we can truly diversify our thought and come up with different solutions and innovations of how we're going to improve healthcare for veterans. Now we're going to continue to improve our healthcare system. If we continue to look the same, we will not improve, we will not modernize. And again, that is one of our commitments. And then most importantly, we need to improve morale across the board. Our workforce provides annual information through an all-employee survey. And this past year was the first year we actually collected information on the impacts of discrimination and a focus on diversity. And there is plenty of room for improvement there. We need to have a more inclusive environment. We need to value all members of the team, and by having your partnership there so that we could really infuse more diversity within our workforce, that is one solution, not sufficient, but one solution to really address concerns of really morale and staff experience in general. So you are critical partners here, and we really are excited that the conversations today will touch on all of the above, and hopefully you'll agree that this bidirectional relationship, bidirectional in terms of benefit, is truly worthwhile exploring. Next slide. Just wanted to quickly flip through these, and actually you can kind of flip through these as I'm talking. Just some general data from AHRQ, another sister agency, just about health outcomes, particularly around veterans. It's not at all acceptable that we do see differing outcomes based on ethnicity, sometimes even gender or age, when we're talking about veterans accessing their primary care provider. Breast cancer mortality even, I do not like the fact, unfortunately, that we are seeing those differences within the veterans that are using our system. I believe the next is colorectal cancer. We also see a distinction there. Oh, and I'm sorry, I got cut off. Which one was African American? I believe it's the lower one there. The next slide, I believe, is even HIV mortality. Unacceptable that we have that higher mortality there. This is not necessarily based on our own circumstances, right? Veterans have a broader experience beyond the VA. Many of them use other systems as well as the VA. So how can we actually address veteran healthcare without looking at it more holistically, without acknowledging that we need the workforce, however, to do that? So we can address equity, but we need the team to do that. And we need to have a broader picture and acknowledge that that data is nowhere near acceptable and that we need to take action. So during the pandemic, we actually did do a significant amount of focused work on getting vaccine administration to our communities of color around the country at higher rates, and actually have been quite successful in that direction. These are just a couple of videos up on YouTube. My good friend Chris Sandals is a medical center director down in South Texas. He gave a good talk. We are really seeking to address these communities as, you know, even again, in the private sector, nothing new, but more than anything, learning from the communities that we need to serve, understanding that we need their trust in order to reach them, and to assure that just something as simple as that, it's not simple, I realize that, but in the larger scheme of preventing other areas of mortality, this really can be as simple as a shot in the arm, but it's such a difficult and complex conversation given history, given lack of equity, lack of trust. And so we really had a purposeful focus on reaching these communities, and that's why we were so successful. In fact, in most communities, we started vaccinating Black and Brown veterans at higher rates proportionally. And we're proud to share that information and share our successes. But again, we need our workforce in order to really support these efforts and expand it beyond vaccine administration. I'm just so grateful that we've been successful in this direction, but there's still plenty of work to do, like I showed in that prior data. Next slide. So what does it look like currently? And I'm just going to leave this out there. Of more than 17,000 trainees that we have in our health system, we actually have good proportions of them from institutions represented on this call. From our minority serving partners, we are proud to have a good proportion, nowhere near sufficient, but a good proportion of our trainees are coming from your institutions. We need more, point blank. And your partnership here is so critical. We partner, thankfully, across the many different types of minority serving institutions across the country. There's good geographic range, there's good occupational ranges and the like, but these numbers aren't sufficient. We have more than 200,000 trainees total in our system, so it's a small proportion. And we know you need that space for trainees. We know you want to expose your trainees to a mission-oriented environment. We have that, and so we need you, and we look forward to the partnerships that today's conversation will hopefully promote. But I believe with that, that's my last slide. And Dr. Greenberg, thank you for allowing me to share just a little bit about VHA. And I really encourage today's conversation and apologize that I can't take part. Got to do some work here in Spokane, but happy to, if you allow, any questions or to be a resource afterwards. Thanks so much, Paul.
Thank you, Dr. Matthews, for your insightful remarks. It was really wonderful to have you join us today. Before we move to the next part of the summit, I just want to briefly mention that we hope to be able to send out the remarks of our key leaders today, so you all have the opportunity to read their important messages, given some of the audio challenges. Without any further ado, I'm going to turn over the presentation to Dr. Martin Eason, our acting Deputy Chief Academic Officer for OIA. Thank you.
We're going to ask you to turn off your video and try again. Nope, it is not. Let's just do no video and just audio.
Can you hear me now, Christy?
Yes, much better. Thank you, Dr. Eason.
I apologize. It's not always perfect, this technology. Well, thank you again. We have 3 informative panels this afternoon with experts from across VHA, veterans and representatives from respected universities and schools of medicine. I'd like to welcome Mr. Terry Albritton to today's summit. Mr. Albritton is VHA's Director for Diversity and Equity and Inclusion. Mr. Albritton comes to VHA from the United States Military Academy at West Point, where he served as the Chief Diversity Officer for the Office of Diversity, Inclusion, and Equal Opportunity. At West Point, Ms. Albritton served as a Senior Advisor Consultant to the Superintendent, Chief of Staff, and as a liaison to top management officials, non-governmental organizations, and institutions on matters of diversity and inclusion. Ms. Albritton was responsible for the development, advancement, and promulgation of diversity and inclusion strategies, training, and enlightenment to drive cultural shifts in the Academy's approach and application of diversity principles. Ms. Albritton will be introducing our panel moderators today. Welcome, Ms. Albritton.
Thank you, Dr. Eason. Can you all hear me okay?
Yes, sir.
Okay, all right, thank you very much. And thank you for allowing me to participate in this very important event. As a Director of Diversity, Equity, Inclusion, I look forward to working with many of you on the call today, as well as your colleagues, and who may not be able to join us today. As Dr. Eason said, we have 3 great panels for you. First, we'll be hearing from our affiliate partners on developing relationships with VA. Dr. Thompson will be moderating our first panel. Dr. Thompson is the Associate Chief of Staff for Education at the Orlando VA Medical Center in Orlando, Florida. Dr. Thompson takes it away.
Thank you. Good afternoon, and thanks again, Mr. Albritton. We welcome all of our affiliation panelists today. You'll have the opportunity to hear from some VA partners across the US and Puerto Rico. I'd like to welcome our panel members. First, Dr. Willie Capers II, Assistant Dean of Student Services and Assistant Professor of Pharmacy Practice, Texas Southern University College of Pharmacy and Health Sciences. Dr. Alfreda Harper Harrison, Associate Professor and Director of the Advanced Nurse Educator Program, Winston-Salem State University. Dr. Vilma Davis, Assistant Director and Assistant Professor, Nursing Program, Lincoln University. Dr. Olga Rodriguez, Professor of Pediatrics and Dean, Ponce Health Sciences University School of Medicine. Dr. Ezer Kang, Associate Professor of Psychology and Interim Director, Clinical Training, Howard University. And Dr. Jorge Falcon, Emergency Medicine Program Director, University of Puerto Rico School of Medicine Residency Program. Before we get started, can each panelist please share with our audience your university's partnership role with VA? Let's start with Dr. Capers.
Good afternoon. Here at Texas Southern University College of Pharmacy and Health Sciences, we're affiliated with the Michael E. DeBakey VA Medical Center here in Houston and the VA North Texas Healthcare System in Dallas.
Thank you. Dr. Harper Harrison.
Good afternoon. My name is Dr. Alfreda Harper Harrison. I'm with Winston-Salem State University in Winston-Salem, North Carolina. And we are affiliated with the VA Medical Centers in Winston-Salem, North Carolina, and in Salisbury, North Carolina.
Thanks so much. Dr. Davis.
Good afternoon. My name is Vilma Davis, and as was said so eloquently by you, Dr. Thompson, I am the Assistant Director of the Nursing Program at Lincoln University, and our affiliation is with the VA here in Pennsylvania.
Thank you. Dr. Rodriguez.
Hello, I'm Olga Rodriguez del Sola. I am Dean of Medicine at Ponce Health Sciences University. Our affiliation is with the VA Caribbean Hospital in San Juan.
Thanks so much. Dr. Kang.
Dr. King, do you have your mute on? We are unable to hear you. Try one more time. So it might be a setting on your end to correct the mic, but we will proceed forward and see if we can catch you on the next round.
Okay, we'll circle back. And Dr. Falcon.
Good afternoon to everyone. Thanks for the invitation. My name is Jorge Falcon. I am the Associate Dean for Graduate Medical Education, former Program Director for Emergency Medicine at the University of Puerto Rico. Thank you.
Thanks so much. So, Dr. Capers, can you tell us about the special history your facility has with VA?
Yeah, our history with the VA actually dates back to 1959 when Wilburn Harris graduated from TSU and became the first Black pharmacist at our Houston VA. Of course, since that time, our relationship has grown. And for the last 35 years, we've had an affiliation agreement where our pharmacy faculty members, they practice at the VA, they teach pharmacy students and residents, and they conduct research. But today that relationship is actually still bearing fruit for Vision 16. The two African-American chiefs of pharmacy are both TSU graduates. So I'm happy to say that Falba Adams, the chief of pharmacy for the New Orleans VA, as well as Cheryl Douglas, the Chief of Pharmacy for the Michael E. DeBakey VA Medical Center here in Houston, is also a TSU graduate. And Cheryl, interestingly enough, made history when she became the first African-American Associate Chief of Pharmacy, and then, of course, the Chief, which she holds today.
Great. Thank you so much. Dr. Rodriguez, can you discuss the important role the San Juan VA Medical Center educational experience plays in mental health in Ponce?
Of course, I think Ponce and the VA system have had a relationship for more than 20 years. And I think that our relationship is key in terms of provision of healthcare, particularly mental health to the population of Puerto Rico, especially in what's related to veterans and to the population of Ponce in the South. Basically, the relationship is related to the establishment of a residency program in psychiatry. We did this 20 years ago. In this relationship, the residents that we began with 4 and then grew it up to 6, do their first 2 years of training in the VA hospital in San Juan, where the VA provides faculty, staff, and of course the patient population for the training of the residents. Then they come to Ponce on the last 2 years of training to participate in our mental health clinics, which basically it's a system where we are the main healthcare provider for mental health services to people that practically are under what would be the equivalent to Medicaid in the U.S. It's this Puerto Rico healthcare system. And they complete their training here, providing services to our people, which are basically from poor families, underserved families. The best of it is that our residents, most of them graduate and stay in Puerto Rico for practice. We have calculated that that'd be about around 70% of our residents that graduate from the program. So the relationship has offered a great, not only health services, but basically has assured to endure that we have high quality faculty or healthcare providers in Puerto Rico. So I think this has gone on for 20 years, flawless, no issues with their relationship, and we hope it continues to go on for many, many years ahead.
That's wonderful. Thanks so much. Dr. Davis, can you share the nursing perspective with us?
Oh, certainly. In comparison with Dr. Capers, and we are like a toddler association with our program at the Lincoln University. Our nursing program started in 2014. And from the inception of our program, we have had an affiliation with the VA. And of course, in nursing, as with others, we need a place where our students can get a good clinical rotation. And the VA has really stepped up for us. And one of the things that is most significant to our department with the VA is when almost every agency hospital kind of closed their doors to us during COVID, the VA said, yes, you can come. Smaller numbers, but your students can rotate. So that was a big plus for us. And we really did appreciate it because, you know, it's difficult to have a sim lab to simulate a person who is having psychotic or mental issues that need intervention. So that was very very thankful. And when we look at our students with their evaluation, they really do love the diversity of exposure there, the various cases that they are able to learn from. So going forward, I am hoping that this will continue to be a partnership where we can always rely on the VA to have our students get their so needed experience. And we are really grateful for that.
That really sounds fantastic. Thank you so much, Dr. Davis. Dr. Kang, let's see. Are we doing a little bit better with the audio?
Everyone hear me?
Yeah, there we go.
Oh.
Why don't you begin by
apologies.
sharing with why don't you begin by sharing with the audience your university's partnership with VA?
Sure, I'll be happy to. Good afternoon, everyone. My name is Ezra Kang, and I am Associate Professor of Psychology at Howard University. One of the core faculties in our Clinical Psychology PhD program. Our main local affiliation is with the Washington, D.C. VA Center.
Great. And would you be able to share with us the value-added relationship Howard University has with the VA, as well as the transition to full-time VA employment post-training?
Right. Well, VA training at the externship, practicum, and also internship level for clinical psychology students in our program has been a much coveted program. I think primarily is because it aligns with our core mission, which is to integrate clinical science and practice to address disparities in health outcomes and also healthcare access. Bearing that in mind, the VA does offer very unique opportunities to kind of address those core needs. On a personal note, I trained at the VA Ambulatory Care Center in LA. And I think I wanted to raise that because I think it's very illustrative of the training opportunities that VA centers offers in terms of working with populations that are historically underserved. At the VA Ambulatory Care Center, we work primarily with VAs with unstable housing, since given our proximity to Skid Row in downtown LA, and also with people living with HIV. It was my first exposure to doing group work with folks that were living with the virus. So that kind of gives you a snapshot of the diverse range of communities that our trainees have an opportunity to work with. The other strength of VA training for our students is the availability of supervision for evidence-based treatment, both at individual and group modalities, but specifically situated in a primary care setting. And that's very important because of the trend towards behavioral health. Many of our students would want more experience working in a behavioral health setting. And also lastly, which is a little more specific to our training at Howard, we're one of two PhD programs that's accredited by the American Psychological Association among all HBCUs. So we have a lot of students that are very interested in having more specialized training in neuropsychological assessment. And the VAs, both locally as well as nationally, do have a reputation of a very well-touted reputation of offering specific training in neuropsych assessment that's coupled with neurocognitive rehabilitation treatment. I just want to add that for the past 10 years, PhD students in the clinical psychology program at Howard, about 20% have trained at VA centers across the country at the externship as well as at the internship level. And that clearly leaves open opportunities for more postdoctoral fellowships and research opportunities.
That's really fantastic. I love to hear the cycle of training and then going out into the community. That's really wonderful. Thank you. Dr. Harper Harrison, thank you for joining the panel. Would you discuss and emphasize the interprofessional experience gained by your trainees?
Absolutely, thank you. Our university is uniquely located such that we have the opportunity to spread our students across 2 VA facilities. And our program has the traditional baccalaureate and our oriented BSN students, as well as our master's level nurse educator, family nurse practitioner, and doctoral students that they use these facilities to complete their practicum, clinical, and residency experiences. The VA offers such a unique experience to our students because they expose them to a variety of clients with complex medical concerns. often very different from those that they would experience when in a traditional hospital experience. These experiences also allow our students to observe and practice skills so that they can become proficient in them. One experience our traditional students, especially those completing their mental health rotations, like is the physician's rounds that they get a chance to participate in. They get an opportunity to see the provider and the client dynamics, and then how the provider himself is able to interact with the care team to manage those concerns of the client. In addition, our nurse practitioner students work with a preceptor, of course, and they have an opportunity to actually care for these clients with these complex medical concerns. And that offers them the opportunity to hone their assessment skills and their diagnostic skills. And that is very essential to the growth and development of a new practitioner. Our nurse educator students have a greater access to clients, enabling them to develop and provide teaching materials to the clients to help them understand their diagnosis, importance of following those treatment regimens, and how to perform essential skills such as wound care, finger sticks, and understanding their blood pressure readings, which is important to help maintain the client's health status. And because the hospital and clinics are set up so that they incorporate these interdisciplinary care circles to help care for the clients, the students are exposed to these multiple opportunities that they get a chance to interact with various departments, and that helps them to develop and foster their positive interprofessional relationships. The care team experience and the care team meetings that they have at the VA offers a great example of the unique experiences that our students get when they're conducting these clinicals at the VA. And at the end of the semester, our students, they provide these evaluations of the facilities. And what we get most is that they've learned so much and that they've had an opportunity to practice their skills, and that they enjoyed the experience overall. And thank you so much for this opportunity to share just a snippet of how the relationship between the VA and our facility has been beneficial to the development of our next generation of nursing leaders.
Thank you so much. I'm always so impressed at the opportunities available in the VA for interprofessional education. And it sounds like your trainees have really had a wonderful time, wonderful educational experience. That's just great. Dr. Falcone, welcome all the way from Puerto Rico. Glad to have you today. What has been your experience working with VA?
Dr. Falcone, you're on mute.
It's on mute. Now I'm on mute. Well, the University of Puerto Rico has an academic association with the VA Caribbean healthcare system for more than 40 years. The hospital has been one of our most important clinical sites, where our residents are trained in emergency medicine, critical care, general surgery, anesthesia, urology, geriatrics, internal medicine, and family medicine, among others. VA Caribbean healthcare system is working in a series of projects to increase the workforce pipeline. And this, of course, include our residents and fellows. So after they end their residency programs, most of them decide to stay in the hospital as faculty, and even having opportunities in the as feeders in the hospital. Among these projects, to increase the workforce pipeline, they have been updating their VA website, and this allow also our residents and healthcare related programs to know the training opportunities and attract more workforce also. So they also have been working in a national pilot to promote and develop a high reliability organization culture. And that's very important because it includes employee engagement, leadership involvement, and psychological safety. So these three pillars promote a clinical environment where our residents and fellows can raise their hands and have a say, bring their perspective and diversity. And this is very important for our residents and for the accreditation agencies also, which are very important on these days. They also have diversity collaborative programs, and that's very important also. So all these efforts have contributed for many of our residents having decided to do fellowship programs at the institution, at the VA hospital, become part of the medical facility, of the medical faculty, and even have leadership positions in our institution. So we appreciate the academic association that we have been having with the VA Caribbean healthcare system for the last almost more than 40 years. In addition to educating them, they also gave them the opportunity to be part and employees of the hospital after they finish their training. So we are very happy with this. Thank you.
Thank you so much. It just sounds like a wealth of opportunity and such a pipeline to post-training experience and opportunity as well. So that sounds wonderful. So if any of you could expand your current affiliation partnership with VA, what would that look like? Maybe Dr. Capers, what would that look like from your perspective? How would you expand your affiliation?
Good question. I would love to see like the Valor program, for instance, be something that I would love to see return. That program was an extremely successful pathway for our pharmacy students to match for residency programs as well as secure pharmacy positions. Speaking of residency programs, expanding partnerships with colleges of pharmacy or just VA funded type pharmacy resident positions would be wonderful. Lastly, I would say that we also have about 6 undergraduate health science programs. So it would be great to expand internship opportunities for those students.
Absolutely. What about you, Dr. Rodriguez? If you could expand your affiliation with VA, if you could get your wish have your wish come true, what would it look like?
Yeah, I will start answering that question talking about the challenges that Puerto Rico has related to workforce. So right now we have a lot of faculty members that are leaving the island to go to the mainland for greater opportunities. So as a medical educator and as a dean and as a peer of the other deans of the other 3 medical schools in Puerto Rico, we desperately need more residency programs in Puerto Rico. When you look at the data, you find that 75% of the physicians that train in the island stay for practice in the island. So my dream would be to have the VA hospital in San Juan to increase the number of residency programs that they offer, and to expand in a manner like we did with the psychiatry residency program, so what we can do that those kinds of dual relationship, so that they can help us a lot with the mostly one of the greatest challenge that we have is paying the residency slots. So if we somehow can share that, we would be successful training more physicians in Puerto Rico. I also want to mention that the VA system in Puerto Rico also has clinics outside the VA hospital in San Juan. There's one in Ponce, there's another one in Maya West. I use them a lot for the training of our medical students. So I wish that those relationships could be strengthened so that I could send more medical students for clinical rotations and experiences in the clinics. But again, I would say expanding graduate medical education using the VA system as one of our major partners in that, for that to occur, that would be a dream come true for me.
Wonderful.
It would definitely benefit Puerto Rico in general.
Absolutely. Absolutely. Thank you. And thank you all for joining us on this very important panel today. Before we turn it over back over to Mr. Albritton, I want to encourage our audience members who are interested in partnering with VA to reach out via the group email or via the OAA intranet page. We will be posting at the end of the summit for additional information. Mr. Albritton, I will turn it back over to you, and thanks so much.
Thank you.
Thank you very much. Thank you. Thank you, Dr. Thompson. Appreciate it. Thank you all to our affiliated panelists. At this time, we're going to show a short video. If you need to take a break, please feel free to do so. And we'll be back in about 1 minute. Thank you.
The Academic Affiliation Partnership and that model has been vital to VHA, our veterans, as well as for our country. 70% of the physicians in this country have trained in VA. Being able to partner with an academic medical center means that our physician staff are also academically inclined, and they will provide cutting-edge care to our veterans. And then when you layer that with the requirements of graduate medical education accreditors and other accrediting agencies, you provide the highest standards for the care that our veterans receive.
The very special relationship that veterans have with our academic affiliates is incredibly beneficial, particularly in clinical research. The VA is known for its work that it's doing in post-traumatic stress disorder, traumatic brain injuries, its work in genomics. The biggest impact it will have on my future career is that no matter where I go and practice psychiatry, I will be able to be confident in my ability in taking care of a veteran should they want to. As a large organization, we have a great continuum of services across the VA that you don't necessarily see in the private sector. So we have everything from outpatient care to acute inpatient care, numerous specialties. We have a great emphasis on mental health care. So I think it's an opportunity for trainees to see a large continuum of care, which they may not be exposed to in other settings.
The VA really holds to an academic standard and, really incorporates teaching and practicing evidence-based medicine in our day-to-day practice. So that's just a great combination.
The academic affiliation partnerships with the VA benefit the trainees in that the trainees will have access to world-class doctors and researchers who are based here at the VA.
Interprofessional healthcare is the wave of the future, and VA is certainly at the forefront of that wave. Having educators here at the VA who are well-versed in interprofessional care, know how to teach it, know how to supervise trainees to be on interprofessional teams, it's a major advantage of the VA healthcare system.
Having the opportunity to continue to grow and develop as a clinician with the support of other providers who are very experienced and accomplished already has been immensely helpful, not only for knowledge and skills, but for confidence as well as a provider.
Mr. Albritton?
I'm going to get started.
Thank you.
Okay, welcome back to the 2021 Minority Summit. I hope you all found the first part of this summit as interesting as I did. As a reminder, please post any questions you may have in a Q&A chat. Second panel to be discussion on scholarship opportunities available across the VA. Dr. O, Associate Chief of Staff for Education at the Seattle VA Medical Center, will be moderating this panel. Dr. O.
Thank you, Mr. Albright, and everybody, you can hear me okay?
Yes.
Great. And go Army, Mr. Albright. I noticed your previous little pin. All right, so allow me to introduce each panel member joining us today. Dr. Patrick Youngblood, he's a program manager for the Health Professions Scholarship Program and the VALOR VA Learning Opportunity Residency through the Office of Workforce Management and Consulting. Our next panelist is Dr. Shirley Simpson, who is program director for the Post-Baccalaureate Nurse Residency Program at the Malcolm Randall VA Medical Center. Dr. Scott Burrows is the National Director for Physician Assistance Services. And we have Dr. Aaron Fritchman in the Oklahoma Army National Guard and resident physician at Medical City Arlington in Arlington, Texas. So welcome everyone. Our panel is really excited to discuss VA's health profession scholarship programs for students obtaining degrees in a variety of professions, including medicine, nursing, and physician assistant programs. These scholarship programs help VA build a diverse workforce pipeline and allows VA facilities to fill critical vacancies, especially in these underserved areas. So let's begin with each of the panelists could please share with your audience your role or involvement with the programs. So let's start with Dr. Youngblood.
Yes, sir. Good afternoon, y'all. And as Dr. O mentioned, we are excited to be here today to share with you the opportunities from our Health Professional Scholarship Program. I am very fortunate to be the National Program Manager for the Health Professional Scholarship Program, as well as the VA Learning Opportunity Residency, or the VALOR program. So thank you all for the opportunity to present this information to you. And if you have any additional questions, we'll be happy to answer them. Thank you.
All right, Dr. Burrows. Dr. Simpson, I'm sorry. Let's go to Dr. Simpson.
Thank you so much for having me this afternoon. I'm Shirley Simpson, and I'm a program director for the Post-Baccalaureate Registered Nurse Residency Program at the Malcolm Randall VA Medical Center in Gainesville, Florida. I'm responsible for recruiting nursing graduates through any means possible to let people know about our nurse residency programs. And I also serve as a scholarship application reviewer. I communicate our vacant seats to our scholarship coordinators so that any recipients who may not have been placed somewhere will know of opportunities to enter a residency in our facility.
Great, thank you, Dr. Simpson. Let's go to Dr. Burrows.
Thank you and good afternoon. I am the Executive Director at the Physician Assistant Program Office. I've been involved with the HPSP program from 2017 through 2021. The PA program office affiliation per the Workforce Succession Planning by WMC resulted in PAs being a hard to recruit occupation and a critical hire. I'm excited to announce that starting in 2022, the PA program office will be involved in a new scholarship program to target veterans to become PAs in the VHA.
Great, that is wonderful. We'll hear a lot about that a little later. Dr. Fritchman. Dr. Fritchman, if you're on, if you got it.
I don't know if my video is going here. My name is Dr. Aaron, graduated from medical school in Fort Smith, Arkansas, and I am a recipient of the HPSP scholarship, and I'm currently attending residency in Medical City, Arlington.
Great, thank you. As the Health Professional Scholarship recipient through the Department of Defense, I served my time, did the HPSP program, did my 3 years. I thought I was going to get out, and then here I am, 22 years later, I retired out of the Army. So I'm familiar with the DoD scholarship programs and its goals. Dr. Youngblood, can you tell us about VA scholarship programs?
Yes, the VA scholarship programs are very similar to the program that you went through with the Department of Defense. It is a program that is established to create a pipeline of quality candidates to care for our veterans. HPSP, as I'll refer to it, was around many years ago. And then in 2016, Congress and legislation brought VA, the HPSP program, back into existence. So in 2016, we initially started giving out scholarships to nurses in our nursing affiliated programs. And then each year, as Dr. Burrows mentioned, we do succession planning and we identify those critical specialties that are hard to recruit or hard to fill. And then each year at Workforce Management Consulting, we then identify those specialties that we want to award scholarships to. So in 2017, we expanded the scholarship program to include physician's assistants, as well as nursing and nurse practitioners. And then each year in 2018, we looked at the same data and we decided at that time through succession planning that we needed to attract physical therapists, as well as physician's assistants, nurses, and nurse practitioners. And then in 2019, we continue to grow. We started offering scholarships to not only the ones I previously mentioned, but also to diagnostic radiology techs, as well as med lab specialists. And each year we review what specialties are deemed critical, hard to fill, and then identify those. In 2018, the legislation passed a huge bill, which is called the Mission Act. In the Mission Act, what that did is that expanded HPSP to include offering scholarships to medical students. So we were very fortunate in 2018 to get that bill passed. And after rigorous writing of laws and writing of forms and so forth for the VA, in 2020, we launched our first scholarships to medical students. Just on a side note, and I'm very proud that Dr. Aaron Fritchman is here with us today. He was actually our first recipient for the VA Health Professional Scholarship Program for medical students. And as Dr. Fritchman don't say too much, but he's a war veteran, prior service, still in the Army National Guard, I believe. And we're very proud to have him as our first recipient. In addition to medical students and the relationships we built, in 2020, there was also an initiative to work with those schools that are Teague Cranston related universities. They have some affiliation with the VA based off their Teague Cranston. And then we also worked with minority institutions to attract veterans to go to those schools. So the Office of Academic Affiliates, along with Workforce Management and Consulting, worked with those minority institutions and those Teague Cranston schools. And I'm proud to say that in last year in 2020, both through our medical students and the initiative that we had with the Office of Academic Affiliates, we offered approximately 65 scholarships to medical students in our first year.
That is amazing. Sounds like there's a lot of opportunities, and congratulations, Dr. Fritchman, for being the first recipient. Now, let me just clarify something, Dr. Youngblood. Is there a requirement to be in the service, or is this open to anyone?
So the program that I mentioned, the collaboration with the Office of Academic Affiliates, that was for veterans. However, all the other opportunities that we discussed, you do not have to be a veteran. This is open to anybody that is attending any of the institutions that are on here today. They're eligible to apply.
Great. Thank you for that clarification, Dr. Youngblood. You also mentioned that there are some successes for scholarship programs for nurses. Let's turn it over to Dr. Simpson. Can you share your experience in reviewing nursing applications, and what are some characteristics that stand out to you when you're looking at these applications?
Yes, Dr. O, I'm happy to talk today with you about the work that I do in reviewing scholarship applications, as well as the interface of the scholarship program with my post-baccalaureate registered nurse residency program. Our site is privileged to offer a post-baccalaureate registered nurse residency program in Gainesville, Florida. And our experience dates back to the original funding opportunity that was extended by the Office of Academic Affiliations in 2008. We were one of the original pilot sites for offering nurse residency programs, and we were the first VA to become accredited by the Commission on Collegiate Nursing Education in 2010. We have up to 10 seats available for new graduate BSNs to start this program each year, and we can offer residency slots to VA scholarship recipients. So nursing schools have become very creative in the past few years in developing methods for educating nurses, including traditional four-year baccalaureate programs and second-degree accelerated BSN programs, as well as several iterations of competency-based baccalaureate programs. For the scholarship programs, there is no requirement for any particular curriculum to be used, so we encourage students from different kinds of programs to apply for BA scholarships. When I review scholarship applications, I use a standardized template to provide scoring on each element of the application, so I do come through carefully to make sure that I have a complete picture of the applicant. However, I can only evaluate what is in front of me. And the most striking applications are the ones which address every item on the checklist. In other words, a complete application packet. Even more important is the description of why an applicant wants to be a nurse and why the applicant wants to serve veterans, as well as an explanation of how that person came to know that about themselves. Especially meaningful are the stories about having provided care to an ill family member, an ailing veteran friend or family member, and an indication of how they contributed to the person's care in a hands-on fashion. The best candidates are those who are fully aware of the physical and emotional support that nurses provide in this profession. Now, according to the Pew Research Center, in 2017, 43% of the people serving in the armed forces were minorities. So we expect to see increasing numbers of minority veterans, making it essential to promote the recruitment of minorities into the profession. The scholarship programs can often mean the difference between fulfilling a passion to become a nurse now or having to wait until a person earns enough money that they can do so.
All right, thank you, Dr. Simpson. Looks like you gave answers to the test, I guess. So apply is number one, be complete in your application, number two, and make sure you care about why you care about veterans, right? So that's it. So that's great. Thank you, Dr. Simpson. We're going to turn it over to Dr. Burrows, who runs the PA program. Dr. Burrows, can you discuss how the scholarship program has helped rural VAs with staffing?
Yes, thank you, Dr. So PAs have been part of the HPSP scholarship program since 2017. And since that time, we have selected 138 students out of over 1,000 applicants. One of the criteria for applying is that the student has already been accepted into one of the 267 ARC accredited PA programs. Schools are very competitive, and for every one seat, 3 apply. HPSP applicants are then all hand-scored by a group of VHA PA subject matter experts, ensuring that the best applicant is selected. PA schools last 3 academic years, which include didactic and clinical rotations. PAs will graduate with either a master's or a doctorate degree. PAs work in all medical disciplines, have signed a service and mobility agreement, and can be direct or non-competitively hired. PAs have been placed throughout VHA, including rural and underserved sites. Starting in 2021, we will increase the rural and underserved areas by a new HPSP scholarship program called the Educational Assistance for certain former members of the armed services. This pilot program will target veterans to become PAs and will award 25 scholarships per year for the next 5 years.
Wow, that's great, Dr. Burrows. I worked with a lot of great PAs in my military career, and they're definitely what we call a force multiplier to take care of our soldiers and veterans. All right, thank you, Dr. Simpson and Burrows. Can you maybe give our audience 1 or 2 words of advice that they can pass on to their students who may be interested in the VA scholarship programs? Let's turn it over to Dr. Simpson.
Absolutely. As you mentioned earlier, I kind of gave the answer to that question, and that is, first of all, apply. Just send in an application and don't let any of the documents intimidate you, because there are plenty of people in our organization who can answer questions about how to fill out your applications. We do want your students to be successful in pursuing a rewarding career in VA nursing.
All right, great. How about you, Dr. Burrows? Any words of advice for potential students applying?
I would agree. The process is very competitive. I encourage to apply early and make sure that you don't leave out any questions unanswered, as each section is awarded points based on their response. You can apply each year, and if you do not receive a scholarship in the first year, please reapply.
Okay, great. So apply and fill out all the questions. So sounds like a recurring theme. All right, great. Dr. Fritschman, as the recipient of the first medical student VA scholarship, can you tell us about your experience in applying for the scholarship and what the scholarship has meant for you during medical school?
Yeah, I worked with the VA prior to medical school, and I just kind of kept a watchful eye on scholarships that were up and coming. And being a medical student, I knew that was kind of high hopes at the time being because it wasn't offered. And then with the passage of the Mission Act, I was able to go ahead and apply for the HPSP. And Dr. Youngblood was very instrumental in helping me get through that, figure out what forms are going to be needed and everything, because I was kind of paving the pathway. As far as the financial aid aspect, it was seamless. The whole group helping out with the administration of the scholarship has just been super helpful. If there were ever any questions, they were quick to answer them, and it's taken the stress out of medical school with a young family. Just having that extra aid there, and just knowing that employment awaits, and that's a huge deal right now in the world of emergency medicine. Having a job already lined up is a big deal.
Great. Thank you for sharing. I know when I went into a medical school at Boston, it was very expensive. And so the scholarship was very helpful for me. And I appreciate you sharing your experiences. And congratulations on your ER residency. It's definitely something that we all need. Do you see yourself working for the VA following your service obligation?
Yeah, I definitely do. I hope to relocate back to Western Colorado and either work at the Grand Junction VA Medical Center or either the Rocky Mountain Medical Center in Aurora, Colorado. The VA is just, they match my personal goals. I hope to just maintain camaraderie with veterans for basically my lifetime, and that's why I still continue to serve in the Guard at this time. I think the VA is kind of one of those places where we always place the patient first, and that's more of a rarity as time goes on with the corporate medical structure. And so I just hope to maintain working in that sort of environment for the rest of my career.
Right, the VA is very blessed to have you serving veterans. Let's turn over to Dr. Youngblood. Dr. Youngblood, do you anticipate any changes to the VA scholarship programs in the coming years?
As you can hear, each year we've expanded and changed disciplines. And we always are looking at that critical to hire list to determine what specialties. And also, because of the success of HPSP, we are definitely on the radar since we do provide that quality of individuals into that pipeline. So is there going to be any expansions or growth? Well, in 2016, when we started HPSP, my annual budget was probably somewhere in the neighborhood of $1 million. In 2022, that's coming up, my budget is about $20 million. So you can see that expansion is there. We are growing, and we are very blessed to be growing. So as far as where is the expansion going, we are looking at the medical students, and we are hoping to bring on at least 50 to 100 medical students every year. In addition to that, there's a recent study that shows that the VA is going to be short somewhere in the neighborhood of 10 to 12,000 nurses every year, based off succession planning and based off what's going on in the population. So we are looking forward and we are planning, and we would like to bring on through our pipeline, whether it be HPSP, whether it be the Office of Academic Affiliates, residency programs, whether it be the nurse transition to practice, about 10 to 15% of those vacancies with new students, with new graduates. So if you do the math, that tells us we want to bring on a large amount, 1,000, 1,200, 1,500, whatever that number comes out to be, but it's substantial. So the expansion is going to happen. We're very fortunate that that the legislation was passed and allows us to offer the scholarships. And we're also very fortunate that the affiliated universities have done a great job advertising for us and getting the word out there. As Dr. Burrows mentioned, the selection rate is about 10%. So each year we receive about 2,000 applications for all disciplines. And we end up offering scholarships anywhere from 150 to 200. One great addition to HPSP is as we evolved, we built a relationship with the Office of Academic Affiliates with our nursing program. So all of our nursing BSN students that graduate, they are then pipelined into the post-baccalaureate nursing residency program. So this helps the VA. It helps us to train and get these nurses ready to be quality bedside providing nurses immediately after they finish the residency. But it is also, in return, a great opportunity for that new nurse to build a solid foundation of her nursing skills or his nursing skills as they graduate and become a new nurse, a new care provider when they come into the VA. So we're excited about that affiliation that we have. And I know that our new graduated nursing students are excited as well. We mentioned earlier about the rural locations. We are definitely targeting the rural locations as well, and we continue to grow with that. As I mentioned previously, the program, once the HPSP recipient comes on board, they have a service obligation to work at a VA for no less than 2 years. And in addition to that, they do sign a mobility statement. That mobility statement ensures the VA that we're going to have quality providers throughout the VA, whether they be in rural locations or whatever the case may be. So I just want to remind Dr. Fritchman that although we will try to get you to Colorado, you may have to take your talents to South Beach like LeBron James, or you may have to go somewhere else to care for those quality of veterans. And I'm sure that Dr. Fritchman is aware of that. But that's all, that's, as you can see, we're growing and ensuring we provide quality of care for our veterans.
Great. Thank you so much, Dr. Youngblood. I got a question. You know, the HPSP scholarship that I went through, they provide tuition, books, and fees. What is the specifics that you cover for the VA program? Is it similar?
It is. We provide 100% books, tuition, approved fees. In addition to that, we provide a monthly living stipend. That's approximately $1,150 per month right now, but that increases every year with cost of living. So yeah, so very similar to that of the Department of Defense.
All right, great. Thank you so much. Okay, all right. Thank you all for your insights today. Let's now turn to address any audience questions that may have come in. We do have some time for a few. All right, the first one is, how do colleges and universities find out which scholarship programs are available each year and which students might qualify to participate? Dr. Youngblood, could you answer that one?
Yes, sir, and thank you for the question. So every year, as we mentioned, succession planning, we identify those critical specialties that are needed. And in the literature that was provided previously or will be sent out, there is a website that is there that has a list of all the specialties that explains everything about the HPSP program, as well as a link on there to apply. In addition to that, the vacareers.va.gov website has information about the HPSP scholarship as well.
Okay, great. And I'm sure we'll have links and stuff available for those interested in the scholarship programs.
And one last thing I'd like to add, just so there's no confusion. Unlike other scholarships, we are open year-round. So once a student is accepted and or enrolled into one of those programs, they are eligible to apply. We do not have cutoffs. We do not have timelines. We review each application as they come in. And as I said, we're open 365 days a year to accept the applications.
Great, that's wonderful. Okay, it was great hearing from Dr. Fritschman. One of the questions is, can the panelists share the experience of other scholarship students, such as what universities they came from and where they ended up being placed for their service obligation? Go ahead, maybe Dr. Burrows, could you take that one?
Sure, thank you. PAs are accepted into any one of the 267 national programs. They are all in-person 3-year programs. Graduates are highly desired by the VA, mostly because the fact is that the mobility and service agreement. The service agreements can be up to 3 years. PAs can be placed in any specialty and do fill critical vacancies and role in underserved areas.
All right, great. And Dr. Youngblood, do you want to put any final comments on where they go, Colorado and beyond?
Exactly. Well, I'll just add that when an individual is getting ready to graduate, usually 6 months before, we start talking to them about where they're going to be placed. We work with different subject matter experts to identify where critical fields and critical vacancies are, so that we can ensure that we provide these recipients to go to those specialties and locations that are needed most by the VA.
Okay, great. Thank you. Thank you, everyone. Thank you for the panelists for sharing. We're going to end this session here. We'll turn it back to Mr. Albrighton.
Thank you, Dr. O. I really appreciate it. Thanks a lot. Just a reminder that all scholarship information that was heard about today will be sent put on sent to those who's registered via their email. Also, we want to, it'll be posted on the Office of Academic Affiliation internet site. We will also share that at the end of the summit. Also, that the team will also post answers to all your questions on their site as well. So our final panel today will be on research opportunities and partnerships with VA. Dr. Chowdhury is the Associate Chief of Staff for Research at the Providence VA Healthcare System and will be moderating this panel. Dr. Chowdhury, back to you.
Dr. Chowdhury, we are not able to hear you. Could you just double check your mic?
All right, I'm sorry. You able to hear me now?
Yes, perfect.
All right, so thank you very much for the introduction, and I'm looking forward to this great session. I'd like to welcome our audience and the panelists, and I'm looking forward to a great discussion. But before we start, I want to give a brief introduction about VA research, because I don't think many people know that VA has a very robust intramural medical and prosthetic research program that's administered by the Office of Research and Development. VA research is often done in collaboration with university partners, other federal agencies, nonprofit organizations, and private industry. For more than 95 years, the VA Research and Development Program has been improving the lives of veterans and all Americans through healthcare discovery and innovation. The strategic priorities for the VA research include increasing veterans' access to high-quality clinical trials, increasing the real-world impact of VA research, putting VA data to work for veterans, actively promoting diversity, equity, and inclusion, the focus of our discussion today, and building community through VA research. One of the recent examples on how VA research has been able to help Americans is how VA was able to pivot in response to the COVID-19 pandemic. Since the start of the pandemic, VA research has undertaken a wide array of activities to support and advance VA's clinical and research missions and help veterans affected by the disease. These efforts have spanned biomedical research, therapeutics and vaccine clinical trials, and data analysis that leverages VA's robust electronic health record system. VA has been part of two major national research initiatives on COVID-19 vaccines and therapeutics, Operation Warp Speed, which you might have heard on the news, and Accelerating COVID-19 Therapeutic Interventions and Vaccines, which is the ACTIVE initiative. In addition, VA has established a coronavirus research volunteer list that has more than 58,000 veterans and other US adults enrolled, with nearly a quarter from minority groups. Now that I've given you a brief introduction to VA research, I would like to go over the goals and objectives of our panel discussion today. Our panel includes esteemed colleagues representing program managers from the Office of Research and Development, leaders from the research offices in the field, and a junior investigator. We hope you will learn how partnering with the VA may help with increasing the diversity of our research workforce and also provide unique opportunities for career development and training in research. With that, I would now like to introduce all the panelists today. Dr. Jose Garcia, the Associate Director of Clinical Research at the VA Puget Sound Healthcare System, Geriatric Research Education and Clinical Center. He serves as an Associate Professor in the Department of Medicine at the University of Washington School of Medicine. Welcome, Dr. Garcia. Next, we have Dr. Hadia Nicole Green, who's an Assistant Professor of Surgery at Morehouse School of Medicine and recipient of the VA HBCU Career Development Award. Welcome, Dr. Green. Dr. Cedrine Robinson, who's the Scientific Program Manager for Behavioral Health and Reintegration in the VA's Rehabilitation Research and Development Service at the Office of Research and Development. Welcome, Dr. Robinson. Dr. Mark Rausch. Dr. Rausch is the Scientific Program Manager for Oncology in the VA's Clinical Science Research and Development Service at the Office of Research Development. Welcome. And Dr. Ronaldo Rumbal, who's the Deputy Associate Chief of Staff of Research at the Houston VA Medical Center and the Vice Chair of Research in the Department of Medicine, Baylor College of Medicine. Welcome, Dr. Rumbal. So I welcome all of you and thank you for agreeing to participate in this important discussion. Before we get started, can each panelist please share with our audience your role and involvement with the VA research? Let's start with Dr. Garcia.
Thank you. It's an honor to be part of this panel. I am a physician scientist and have an active VA-based research program that is funded through VA, the National Institute of Health, and the Department of Defense. I am also a mentor to undergraduate students, medical students, residents, postdoc fellows, and junior faculty members. I review grants for different organizations, including VA and NIH.
Thank you. Dr. Green?
Hi, good afternoon. Again, it is an honor to be here as well. I am an assistant professor in the Department of Surgery at Morehouse School of Medicine and a recipient of the VA Historically Black Colleges and Universities Career Development Award.
Thank you. And Dr. Robinson?
Hi, good afternoon. I'm very excited to be here today and participate in this conversation. I am a scientific program manager for behavioral health and reintegration, and just as importantly, I am the co-chair for the Diversity, Equity, and Inclusion Working Group in the Office of Research and Development. And so our work is largely focused on stimulating the pipeline of diverse investigators, and I'll be talking more about that shortly.
Great. Dr. Rawls?
Hi, I'm Mark Rolfs, and I work in clinical science, and mostly cancer is my portfolio. I also have the great privilege to be co-chair with Dr. Robinson in our Diversity, Equity, and Inclusion Working Group. And I've launched the core recruiting site at Atlanta Morehouse Partnership, and I'll tell you a little bit more about that later.
That's great, thank you. And Dr. Rumbal?
Good afternoon. Thank you for the privilege for being on this panel. I'm a physician scientist at the Michael E. DeBakey VA Medical Center in Houston, Texas. As Deputy Associate Chief of Staff for Research, I oversee laboratory research program throughout our facility, and I also direct a multidisciplinary research and mentoring center, the Center for Translational Research on Inflammatory Diseases, which also sponsors a training program for postdoctoral fellows based at our VA.
No, thank you. So as you can see, we have a star-studded panel here from the research service. So the Office of Research Development has established a diversity, equity, and inclusion work group, as Dr. Robinson, Dr. Ross just mentioned. As a co-chair of that work group, Dr. Robinson, can you please tell us about the mission of that work group?
Yes, absolutely. So first, I just want to mention that, today we've heard about so many different opportunities for partnership with minority serving institutions as it relates to career opportunities for students, faculty, and investigators in those institutions. And so within the Office of Research and Development, this is yet another potential pathway for career opportunities for individuals coming from minority serving institutions. And so
our employee-led diversity, equity, inclusion working group formed in July 2020 to really focus on developing a pipeline of opportunities from individuals from minority serving institutions and other investigators coming from other institutions. And so that is one of the primary missions of the group. So it is to develop a diverse pipeline of VA investigators, as well as stimulate research on minority health and health disparities. We are also working to promote inclusion within our own office and to promote equity in all of our scientific activities. And so I should mention that our activities are data-driven. I'm a clinical psychologist / researcher by training, and so are my colleagues working in the office. They also have research backgrounds, and so our activities are driven by data. And so what that meant is that we had to take a look at the data as it relates to VA investigators. And so an analysis conducted by our subcommittee identified that among researchers who are funded by our office who reported their race or ethnicity, we found that less than 1% report being African American and about 1% identify as Hispanic, and even fewer numbers as Native American. And so while these numbers were incredibly sobering for us to see, and we knew prior to doing the analysis that we had a lot of work to do, but I think many of us were further driven by seeing numbers that, we heard Dr. Matthews talk today about the work that needs to be done in terms of workforce and other aspects of VA, but to see numbers of 1% is really motivating for us to come up with a plan and to do something about it. And so we know that partnerships with minority serving institutions is critical for us to address the healthcare and research needs of the diverse veteran population that we serve. In a similar vein, we took a look at research topics as it relates to minority health and health disparities among veterans, and identified that while there is work being done, we are supporting research on this topic. There is much more to be done. And so that is a part of our mission, and we have efforts underway to address gaps by stimulating research on minority health and health disparities through by making it clear to investigators that these are topics that we're interested in, and providing incentives and noting this area as a priority. It's also in our mission to ensure equity in all scientific processes, including the peer review process. And so, as many of you know, in terms of getting research funded, you can write something up, be really proud of it, but it has to get through peer review. And we know from other research infrastructures like the National Institutes of Health that there are barriers for some racial and ethnic groups as it relates to the success of their proposals. And so we are taking a look at our peer review process by establishing a way of collecting data of our peer reviewers and looking at opportunities to provide training for investigators who are earlier in their career to participate in the peer review process. And so I'll stop there. My colleague, Dr. Roche, will share more.
Well, thank you very much. I think it looks like there's a lot of activities going on in ORD and different facets of trying to address this issue of diversity, equity, and inclusion. So, Dr. Ross, as a co-chair of the work group, can you tell us how VA is supporting, say, young researchers from underrepresented communities?
Sure. We've as Sandrina had mentioned, we're an employee-led diversity and equity inclusion working group. And Sandrina and I actually got started talking about this in early 2019, when we were looking at how do we get more people into our pipeline. I went to an HBCU and we didn't find really good opportunities of how we can bring people up from minority serving institutions into VA research. And our working group, one of the things that we established was a grant writing workshop we did a couple months ago for individuals who'd applied for a career development award, didn't get in. They were from a background that we don't have many people from a disadvantaged background. And we did a workshop with them to help them develop a stronger grant application to come in. Another thing we're really excited about is we launched a diversity supplement award. And this is a entry-level candidate who links up with a VA supported merit awardee in any of the different services. And they do 1 to 2 years at probably about the postdoc level. And it's completely funded for their salary and some research materials, and get them ready to apply for a career development award. So it's a great way to launch that. We just got those applications in, and we'll be reviewing them this month and seeing which ones we fund. About in March 2020, I working with Morehouse and Atlanta VA, we launched what we call a core recruiting site, a partnership there between those two institutions, the VA and Morehouse, to bring in a pipeline of researchers that at Morehouse at the medical school there or others that can start to get involved with VA research. And we're looking for other universities to partnership in a similar way with that program. And then the last thing that we're really working on is how do we get undergraduates involved at the VA or even pre-docs? And we've run into some difficulties, but I believe Sadrine and I are really at the point where next summer we will probably be able to have some ways to fund some of those experience. We believe that that could be a great pipeline for people to get VA experience, learn about the VA, learn about what's going on in research. Maybe they go on to research careers, maybe they go to be an MD or a clinician, and maybe they just want to work in one of the research projects that are going on. But we think it's a great way. And she'll tell you a little bit more about that program. She's been the champion of it, and I've just been in the background supporting her as we build that program.
Oh, no, thank you. Thank you very much for that information. I mean, I think this is really interesting and important for people to understand, because they always think of a medical center, they think of medical students and residents and fellows, but the involvement of VA in undergraduate research it's extremely important. And I would love to hear a little bit more about it from Dr. Robinson, if you want to continue on that, Dr. Robinson.
Yes, absolutely. So as Mark mentioned, much of the work that we support now is really starting for individuals that already have their PhD. Everything within that ORD directly funds is kind of, PhD and up. And so we recognize that it's so critical when we talk about diversifying the pipeline. We can't just work with people that already have their PhDs. That's not having a real impact. And so we kind of see a really great opportunity to kind of reach individuals at the undergraduate level. And so all of that is really in its beginning stages in terms of ORD trying to develop its own program. I will say that there's locally at specific VAs, work is already underway, and there's programs that are being launched as early as this summer. So the Palo Alto VA, for example, has a program that is targeting individuals from underrepresented backgrounds in science, and that is recruiting undergraduate. They are recruiting undergraduate students kind of as we speak. And there's a couple other VAs that are also launching programs this summer. And so I think we'll start to see more of that kind of at the level of individual VA. So I would say at this point, if there are individuals, in this meeting today that have interest, we are looking for opportunities to collaborate in order to launch the programs within ORD. And I'd also be happy to connect you with the programs that already exist.
Well, that's very helpful information. Now that we've heard about so many activities and programs that ORD is pushing out, I just want to kind of pivot to the field a little bit. And Dr. Garcia, VA is so fortunate to having you serve our veterans. Can you tell us some examples of how your VA Medical Center is supporting minority researchers and also for the process of developing a research career at the VA?
Absolutely. Yeah, the VA offers opportunities for career development and research at all levels. Undergraduate students, for instance, college level students that are considering a career in biomedical sciences can apply at my VA in Seattle, the Puget Sound VA, for a without compensation position and work as volunteers in the lab. So in some instances, this may allow them to claim credit at affiliate institutions. In my case, it's the University of Washington, that can be used towards a degree. So I'm glad to see that ORD is actually working on making this an official process, and I'm looking forward to working with them on this. Also, graduate students and postdoctoral fellows can work at the VA as part of agreements with affiliate institutions or through grants managed by the VA or VA nonprofit organizations such as NIH or the Department of Defense grants. For some eligible individuals, career development awards may be available and are often the best way to transition into an independent research career. And oftentimes, this is the most attractive opportunity at this stage in their careers, more so than NIH-sponsored K awards, for instance. So the VA is particularly interested in developing the career of underrepresented minorities, and specific grants are available. For instance, the Diversity Supplement funding opportunity that was recently established, and it was discussed by Dr. Roche, that is being promoted to the site. So I had already heard about this opportunity. So this will fund this early career scientists and provide their salary and also some money for research and travel, so they can really accelerate their career, with the expectations that then they will apply for their own career development awards. So the VA is actively invested in the development of the careers of underrepresented minorities.
Yeah, I completely agree with you. I think also in general, the VA has been committed to career development awards. As a career development awardee myself, helped my career in the VA, I really appreciate it. And now moving to a recent career development awardee, as we have understood that research awards are vital for career development. Dr. Green, as a recipient of the VA-HBCU Career Development Award, can you share about your experience applying for the award and what you were able to accomplish since receiving it?
Yes, absolutely. So first, I would like to thank you all for this opportunity to represent the VA Historically Black Colleges and Universities Career Development Award recipients. I am proud to see the VA's commitment to diversity and inclusion, and I applaud and encourage the systemic and measurable actions to end internal racism by improving access to information about funding opportunities and diversifying the reviewers involved in the peer review process. My experience applying for the HBCU Career Development Award began in 2014 with Dr. Tashaka Cunningham. He was the program officer at the time who persevered and pioneered this specific initiative to address the disparity in funding, because less than 1% of VA-funded research scientists are African American. As a side note, I'm very happy that Dr. Mark Roche and Dr. Centene Robinson are now continuing this effort to ensure diversity among VA-funded researchers with the DE&I working group. So back to my experience. Dr. Cunningham reached out to leaders at HBCUs, and one of my mentors, Dr. Shri Singh at Alabama State University, highly recommended me. My first application was peer-reviewed by a diverse panel of investigators. And even though it was not funded, the feedback was genuine and sound. When I modified my proposal based on the reviewers' comments, I was funded on my second submission because of the merits of my proposal, not the color of my skin. This should always be the case, regardless of the VA funding mechanism, and any peer review panel should have diverse representation to ensure racial bias does not interfere with the merit-based peer review process. As one of the first African-American women to earn a PhD in physics, I developed local and targeted cancer therapies using laser-activated nanoparticles. I reimagined ablative therapies by designing a patent-pending nanoparticle that is more uniform in shape and size than those that are commercially available. This innovation led to a single 10-minute treatment, intratumoral treatment, that completely eliminates solid tumors in 15 days with clear tumor margins and without chemotherapy, radiation, surgery, or any observable side effects. My Career Development Award has afforded me the opportunity to publish several manuscripts as senior author about my technology. And for me, and this is the part that I am the most excited about, my award has helped me establish relationships and collaborations with surgeons within the VA who want to conduct clinical trials with the cancer treatment I developed to help veterans with difficult to treat cancer. And 7 VA surgeons have provided letters of support for my clinical science R&D merit award proposals. In addition to their academic accomplishments, because not only in the VA, but even in the National Cancer Institute and other government funding agencies, the funding of African American scientists has not been common. The community learned about my Career Development Award, and it launched me into a national spotlight. And I've received a lot of national recognition, including being named by USA Today as one of the most inspiring women of the last 100 years, along with Eleanor Roosevelt, Hillary Clinton, Michelle Obama, Oprah Winfrey, and the founder of the Girl Scouts. And one of the things that I think, even though I've had a lot of accolades, that is most humbling was 1 year, 2 years ago, because of the VA Career Development Award, the Girl Scouts named me as one of the most outstanding role models. So to know that there are other young women and women of color and women of all races who look at me as a national role model because of the funding that came from the VA, I'm truly humbled, I'm grateful, and I take this opportunity to be a role model and an example as something that I hope, as one of the first African-American females to have this position, that this opens the door for others to come behind me and really, truly, and sincerely increases the diversity of VA-funded researchers. Thank you.
Thank you very much, Dr. Peen. I'm sure ORD and the VA is proud to support an inspiring researcher like you, and you certainly, pave the path to many more to follow your footsteps. And so thank you for your comments. In trying to expand research opportunities for minority faculty and students, I was wondering, Dr. Rumbaugh, if you could say, how would the VA, in cooperation with the affiliated universities and educational institutions, fill the workforce pipeline by recruiting scientists from underrepresented populations? And I was wondering if you have thoughts about that.
Yes. Thank you, Dr. Chaudhry. I'll provide examples of 3 approaches that we've used here in Houston, VA, which include coordination with our primary academic affiliate. Number 2, cooperation with minority serving institutions in our city. And number 3, through federal programs aimed specifically at promoting diversity. With regards to coordination with our primary academic affiliate, in the case of our VA, our primary affiliate is Baylor College of Medicine. And in preparing for this summit, I learned that Baylor has outreach programs aimed at underrepresented populations starting as early as middle school. For example, a program with Ryan Middle School that has nearly 90% students from underrepresented populations, and one with a Michael E. DeBakey High School for Health Professions with nearly 50% underrepresented students, offering opportunities in research. While beginning at an early career stage would be wonderful, I think there are other programs through our affiliate that are more suitable for VA researchers. One is a summer research program for undergraduate college students, which currently has 30% of students from underrepresented groups. And some of our VA researchers have used that as a means to recruit underrepresented students to their VA labs. There's 2 other programs through our primary affiliate that are solely for underrepresented students. One is at the post-baccalaureate level, and another is for graduate students. So second, with regards to cooperation with minority serving institutions in our area, so in addition to our primary affiliation with Baylor, our VA has affiliation agreements for a number of programs at a variety of institutions, several of which are minority serving. In addition, a number of our VA researchers, including myself, perform collaborative research with investigators at those institutions. I'll give you one example is there is a very large, highly ambitious research center application that several researchers from our VA are participating It's a multi-institution application to the National Institutes of Health that includes Texas Southern University. You heard from Dr. Capers. That is one of the historically Black colleges and universities. And it also includes the University of Houston, which is a Hispanic serving institution in the area, as well as our primary academic affiliate. In addition, we have also been successful at recruiting underrepresented students from, for example, institutions that are emerging Hispanic institutions. And we've had several summer undergraduate college students that in our center that have we've recruited that way. And lastly, I want to talk about another strategy we have used is through federally supported programs aimed specifically at promoting diversity. You heard about the VA ORD initiative, but in addition, our VA researchers have been able to recruit trainees from underrepresented backgrounds, for example, through supplements from the National Institutes of Health that are provided to either individual investigator awards, for example, the R01 award mechanism, or to institutional training programs, for example, the T32 award mechanism. In RVA, we have one of those T32 awards, which has allowed us to recruit postdoctoral trainees in general and several underrepresented minority trainees. And then there's other federal programs that are standalone, aimed specifically at promoting diversity, such as the NIH-sponsored Initiative to Maximize Student Diversity, or IMSD. So again, in our case, while these are managed by our academic affiliate, a number of our VA researchers have sought these supplements to recruit individuals to our VA. So again, in our case, coordination with our primary academic affiliate, cooperation with minority serving institutions in our area, and through federal programs aimed specifically at promoting diversity has been successful. Thank you.
Thank you very much, man. I think that information is really, really important that people don't realize that in addition to the intramural research program, we have opportunities to have some training programs and other that are extramurally funded by the NIH that are used by VA researchers and used for recruitment purposes in the VA as well. So thank you for that information. I was wondering if Dr. Garcia, if you can give our audience one or two words of advice on how they can partner with the VA. Is there more information they can pass on to their colleagues, postdocs, and students who may be interested in VA research programs?
Yes, I would recommend people to be proactive and reach out to their local R&D offices or target R&D offices. So you may be located in Houston, but may want to move on to Dallas. So you can look at and reach out to that R&D office or to individual investigators that are working at that VA that are in your field of interest, maybe a leader in the field, and inquire about potential opportunities. Navigating the system and finding the best match for each person may take some time. And so I would say at least 6 months or so. So establishing these connections early is recommended.
Great. Anything else that you would like to add, Dr. Rombard?
So I agree with Dr. Garcia. And if I were to just add, in addition to contacting the local research office, other possible strategies to identify VA investigators may include searching recent published articles from the particular VA, as well as searching public databases of active funded research studies, for example, the NIH reporter site, or even active clinical trials being done at the VA through clinicaltrials.gov.
That's really good information. And I think some of us remember that when VA was not part of the reporter, but now all the VA grants are on reporter, so they're easily searchable, which has been great. And also the list of all the associate chiefs of staff and administrative officers for research is available at the ORD website, and I'm sure in some of the notes that come with the programming, we can share that with people, so you can look up your local research office. So this was a really great discussion, and I really thank everybody for their insights and the information that we provided to the group. I think we have time for a question here. So let's turn to some audience question. The question is, what is required for a career development award, and what are the benefits? I was wondering, Dr. Roche, if you wouldn't mind answering that.
Sure. And I just want to say that ORD website is a great place to look to see. We highlight researchers that are on the cutting edge. Students and others could see what's happening. If there's an area they're interested in, they could reach out to them. And hats off to Dr. Green. She just happens to be in my portfolio. We like having rock stars in our portfolios, and working with her to get her merit award funded here in the next round for her to keep her research going.
Thank you.
One of the things, to be able to get a career development award, you really have to have a desire to want to work in the VA. You know, the VA is a very unique place, as some of the videos showed. Working with men and women who served in our country, and they're just unique patients that you see. And being able to do research in that field and help these individuals who gave so much of their lives to us has to be your passion. You have to want to do that to be in a career development pathway. Then you have to be a U.S. citizen also. You have to find a VA mentor, and that can be done through contacting that VA and an ACOS, reaching out to one of us program officers or program managers here at ORD. Sardrine or I can work around and pass words around to other people. If you have a student who's really interested in that and how we can get you open that door up. A mentor is really important. And that's at the VA career development level or any other federal agency. Having a great mentor who's passionate and is going to support you, push you, and get you to where you need to be for your career is really important in that. And the third part is career development, that you have to make sure that you submit what we call a letter of intent. So you have to be accepted to be able to apply for a career development award. And a letter of intent is basically you're given an outline of what your application is going to look like. And it goes to each one of the different services. And we review that and we say, hey, yes, you're qualified. Come on in with an application. And those are the four big parts. And one last thing, the RFA that Dr. Green got funded on was specifically for HBCUs linking to a VA. We've now expanded that, and it should be coming out in our next round of RFAs to include all minority serving institutions. And that wasn't there before. So we look forward to getting some applications from down there in Texas and other areas around the country for minority serving institutions into that RFA. So we're really excited about that also.
Well, that was great. And thank you, Dr. Ross. And I know there's lots of questions on the chat, and the staff will be putting together answers to those questions, and they'll be forthcoming. So I want to thank everybody for their participation today. I think this was a great discussion, and I hope we gave some useful information to the audience on how to approach, to participate in VA research as a career development awardee, as a trainee, or as a researcher. And thank you for this opportunity, Dr. Greenberg, for me to moderate this panel. Back to you.
Thank you, Dr. Chaudhary, and thank you, Dr. Rolch. And again, thanks to all our panelists, moderators, as well as Mr. Albritton. I'm delighted to let you know that Secretary McDonough has kindly offered to give his remarks again due to the earlier audio challenges. Without any further ado, I'll turn things back over to Secretary McDonough. Thank you.
Thanks, Dr. Greenberg, very much. And how do you read me now? Do you read me okay?
Yes, sir.
Great. All right. Well, Well, thanks everybody, and I'm totally embarrassed that not only was I the guy who had to be reminded to unmute himself. Apparently, I gave like 12 minutes of remarks, not knowing that they were basically unintelligible. So, my apologies for that. And let me just kind of hit the high points to just underscore why I believe that the relationships that you're working today, that Dr. Hildreth, you've been so critical there at Meharry Medical College in helping us to develop, why solidifying and amplifying those is so critical to the national interest, so critical to, for us at VA, not just the VA today, but the VA of tomorrow. And I think that's basically underscored by a 2020 that none of us will ever forget. It will be forever remembered as the year of the global pandemic that began and killed nearly 600,000 Americans. But we'll also remember 2020 as a year in which, in so many ways, our nation's sordid history of racism boiled over. Oftentimes, as too often has been the case in our history, with deadly consequences. The year that hate crimes against Asian Americans in our largest cities skyrocketed by 150%. Perhaps most relevant for our purposes today, the year that people of color died at far greater rates of COVID-19. Statistics tell the terrible story. Throughout the pandemic, Black people have been almost 1.5 times more likely to get COVID, nearly 3 times more likely to die from it. Latina people have been almost twice as likely to get COVID. Those who are infected, nearly 3 times more likely to die. These disparities are tragic and they're unacceptable. And in many ways, this year brought into even sharper and more painful focus the disturbing effects of racial biases and stereotypes on the quality of health and healthcare people of color endure. Now, these disparities have festered since our nation's founding. So as Dr. Matthews made so clear in her very moving presentation, I thought, nobody, least of all you and not me, is under any illusions that ending them will be easy. Righting these wrongs will require all of us pulling in the same direction at the same time to drive that change. I actually worked very closely and am close friends with somebody who believes deeply in what Dr. King preached, which is that the arc of the moral universe bends toward justice. But we have to do the bending. In fact, we can and must do the bending. With the pandemic, we just proved that such a mobilization is possible. Let's think for a moment about the enormous effort that went into responding to that worldwide crisis, finding, testing, and distributing an effective vaccine. In a little over a year, we went from a global pandemic to vaccinating 63% of Americans. Last March, that level of progress would have been almost unimaginable. And that level of progress is not enough, I underscore, because we still see this day, today, access to the vaccine for people of color is too slow. But we are able to make progress, and we're able to make progress because of doctors, researchers, scientists, like these unbelievable people I get to work with at VA. We're unified and operating from a justifiable sense of urgency and a deep commitment. We now need to apply that same unified effort, that same urgency, that same deep commitment, saving lives and ending racial disparities in healthcare that have festered for far too long. This challenge is every bit as important now, especially at a time when our veteran population is becoming more diverse. By 2040, minority veterans are expected to represent 37% of the veteran population. By 2050, more than half of our veteran population. These numbers make clear that we must be far better prepared to answer the specific healthcare needs of our very strong America. Here's what those numbers don't tell us. Only 1% of physicians identify as Native American, Native Hawaiian, or other Pacific Islander. 5% of physicians are Black. 6% of physicians identify as Hispanic. Only 12% of students graduating from our nation's medical schools are Native American, Black, or Hispanic. Think about it. These are massive problems. These are national problems. And there are problems for VA and for the veterans that we serve. It affects our ability to deliver the best quality healthcare possible for the 23% of veterans today who are minorities. We have to reduce those inequities by quickly increasing the number of minorities preparing for med school, working their way through med school, graduating from med school. And I want to see them coming to practice at VA. Just heard about the remarkable opportunities that come with that. And fortunately, right now, VA has an opportunity to make lasting change in achieving equitable outcomes in healthcare for our veterans, their families, caregivers, and survivors. We have the strong support of the president, who's committed to advancing racial equity across the federal government and across the country. We're looking at new ways to engage partners like each of you to strengthen our outreach and increase our access points to underserved communities. We need to be in those communities. In April, I launched our department-wide IDEA task force, inclusion, diversity, equity, and importantly, access, to weave those principles into the fabric of our mission. A central component of the task force focuses on building deeper and new relationships with existing partners like you to learn best practices from organizations like yours, organizations that know far better than I how best to serve diverse communities. Together, VA and our partners can work to deliver consciously, aggressively, urgently change the way benefits, care, and services are delivered to marginalized and underserved communities. And our Office of Academic Affiliation will continue to be central to training, managing, developing the future VA workforce serving veterans. 70% of the nation's physicians receive their training at one of VA's medical facilities. 70%. We need more physicians and healthcare professionals training with VA. That's where you come. There are around 700 minority serving physicians on our team. We're only affiliated with 200. That's a huge disparity. We need the other 500 to partner with us so that we can train, manage, develop, partner with, and build a future healthcare workforce that looks like America. Now, building that pipeline will take some time. You know that it takes years to train new physicians, psychologists. So we're making the training, the scholarships, and the research at VA a critical part of that pipeline to diversifying health. You've been hearing all throughout the day today how your trainees can come to VA and receive clinical training in over 40 health professions. You heard about how your trainees can come to VA and get scholarships to pay for medical school, nursing school, physician. You're going to hear, or you have heard about how your trainees, in fact, develop their portfolios with grants and innovative research that grow dynamic, diverse leaders in the healthcare field, and in the healthcare field focused on the issues of our communities of color. So I'm delighted that you're here because we need your help. I want to leave you with one final note on why diversity matters so much here at VA, why it matters so much to the country, and why I'm so excited that we are partnered with you. We need our workforce to look like America, not only because it's the right thing to do, not only because it's the fundamental manifestation of the strength that uniquely belongs to America as the most diverse country on the face of the planet, but because that workforce can save lives. That work we're doing here is as simple and as important as that. It's perhaps most clear when you look at the tragic case of racial disparities in newborn death rates. Set aside for a second the heartbreaking national tragedy that is the maternal death rate for Black moms. Consider this, Black newborns are 3 times as likely to die as white newborns. Itself a horrific encapsulation of the systemic racism of our nation. But a recent study found that this crisis can be addressed in the simplest ways. Hire Black doctors to take care of Black babies. The study showed that when the doctor of record for Black newborns was also Black, the baby's mortality rate was cut. True for adults too. A similar study showed that Black doctors treating Black men could reduce the Black-white gap in cardiovascular disease mortality by 19%. If our country has doctors and caregivers who look like the population they serve, we can save the life of or a friend, or a father, a mother, a brother, a sister. And in so many cases, we can save the life of a veteran who fought for our country. Sacrificing her life, her health, his life, her health, for freedoms that they may not have fully enjoyed. President Biden appointed me to lead VA with a clear mission to be a fierce, staunch advocate for veterans. When he did that, he wasn't talking about some veterans. He charged me to care for all. That's what we're asking you to help us do. Partner with VA to serve all veterans. Be a part of the most noble version there is in government. So thank you all very much for letting me come back and talk to you again. I hope this was mildly more intelligible this time. I am thrilled to be, not only thrilled, but honored to be able to work with this team of clinicians, of professionals that you're spending a couple hours with this afternoon. And I'm really grateful for the partnership that we have with you. And I look forward to deepening that and to growing our list of partnerships. So, Dr. Greenberg, thank you so much. I hope that was better. Was it more
Yes, sir.
Great, thank you.
I want to thank you once again on behalf of all attendees to today's summit, Mr. Secretary, for taking the time to come back and to speak to us once more. We greatly appreciate your remarks and your support of our shared mission to serve veterans and develop a diverse VA healthcare workforce to meet this end. Thank you once again, sir.
Thank you, Paul. Thanks, everybody.
In closing, today's 2021 Minority Summit has provided a wealth of information. VHA and the Office of Academic Affiliations is eager to collaborate and connect with all the attendees at today's meeting. Our goal is to strengthen our current partnerships and develop new partnerships with minority serving institutions and their trainees, especially at those institutions that have not yet affiliated with VA. We have put the OAA website address on the screen. We will be posting the questions received today and responses, as well as additional information on partnership opportunities and scholarships on our website over the next week. We will also share information on future undergraduate shadowing opportunities as the program becomes finalized. We look forward to hearing from all of you and working together in serving students, VA medical centers, and most importantly, veterans. Thank you all for your participation, and I wish you all a wonderful rest of day and evening, depending on your time zone. Thank you all.